My on my garbage receptacle. This is my picking forceps. This is the dressing forceps. I have my vacuum scissor. I have my plaster. I have here my cotton balls with oxinada. I have here my betadine. Okay, in the hospital, there are two kinds of betadine. Betadine antiseptic, betadine wash. They are in the same color, except ang betadine wash is lighter brown. Mara siya pili tapos. Diluted naman. Ang betadine antiseptic, it is dark brown in color, and yet sticky siya. So those are the difference. So what you can do is do the betadine wash first. This is betadine antiseptic. So it is called betadine antiseptic because there is cleaning ability that is inside here that makes the wound dry. Okay? This one, preliminary cleaning when you say betadine wash. So ascertain the length of the wound. Be able to pick up the picking forceps. First, you have to open all your receptacles. When you open, do not do it like this. Open it this way. Why? Why upside down?
Hindi rin makontaminate, ma.
Okay, it will not be contaminated because the inside of this is very clean. Then, with taking forceps, you should be ambidextrous. What do you mean by ambidextrous? You can work with your right and your left comfortably. So, I'm going to use betadine wash. When you are going to transfer, be sure this will not make contact. The tip of your forceps will not be in contact with your dressing forceps. And then, if there is excess fluid, you can wring it like this.
Okay.
You can wring it like this para dili pag-confusion. Okay. Then, I should be able to put this something here.
Pag-download ko niya, Risby. Ikaw sa dali ko. Pag-download na.
Ay, full na?
Kanilang. You can put a paper down. You can put there para dunay mga tulo-tulo. This one will not be directly going to your table. So from we start, this is the top, this is the bottom. We start in one direction. One. So use the other sides again if the wound is not heavy. 2, 3, 4. Start. Okay. Pick again. Pwede nang hindi ka mag-down-down kung dili heavy, but it's the wound is heavy, you have to protect the hand from moving. 1. So if you are going to clean, apply gentle pressure. Gentle pressure. 1, 2, 3, 4. Start. So, ascertain again the severity of the wound. If it needs to do more cleaning, use 3 to 5 cotton balls for each solution. You understand? Now, I do ascertain no more 3 to 5 cotton balls. At least we will be able to assume na 3 cotton balls na to. Huh? Okay, so this is 50, this is dressing. So I go now to, I have to ring it para dili tulog-tulog. Okay. 1, 2, 3, 4. Start. Okay. So, if the wound again is not longitudinal, it is somewhat rounded. You are going to start from inner or from the center going outward in circular motion. So wider, no? Wider. Dili kay diha karagid taman sa perimeter sa wound. So the perimeter of the wound is here. So you have to have 1 inch allowance outside from the wound area. So you are going to use again the other portion. Your hand should not be here. Let your left hand also help your right hand. Okay? 3 to 5 cotton balls. Yes. Pwede din. Pwede din. Okay. Because but this one here is already dressing corset that adheres to your cotton balls. So I might as well put it here in our sector. Here. Okay. Ganin din na siya, no? Ganin. Okay. Or, kung dili mo gusto ibutang ang excess solution, you can do it like this. Sa picking corset mo. Do it like that. Kasi kato, there is already the dressing corset, so I do not want this to be contaminated. That's why I put it there. So if you want to really be sure, kanin sa ang picking corset, mong iana, then transfer it again to dressing corset. Then you have to lock. Kasi kung dili mo i-lock while cleaning mga hulog, so that is tantamount to, that is against you, meaning you do not know your procedure. Center again. So, once you are outside already, do not go back to the center. You have to change your cotton. So, this is the first use. Okay. This one is not contaminated. You can do like this again. On the center. Always start on the center. This one, never hold it this way. Why? Okay. It will go back and forth the sterile solution. So you have to always point it down. Not below the waist, but
above the waist and below the head.
Below the waist is considered unsterile. So this is the dressing corset. Now, if there is no ointment, you are going to put ointment in the tongue, then put it this way or around again. Ointment. Then you can now remove your gloves, or it is sterile. You are going to open. Use again the picking corset. So granting this is already open. First layer. This is the first layer. Second layer, because there is still blood coming out. So I want the gauze to be thick. Uy! Ibahin na. Ayaw lang pa is picture. Kaya naulog na naman. Sige lang, balik.
Kauna na.
Then, okay, so this is thick enough.
Ang fan.
Or you can double it already. For example, double it already so it will be neat. It will be neat in appearance. So if you are going to put band-aids, it should be neat because you are walking around the street, so you do not want it to look untidy.
Okay, nursing is an art. Nursing is an art.
Nursing is an art.
Accident.
This is blockbuster.
The Harlem Shake ang kuan. Ang gos.
Sagunting.
Sangit tani, oh. I will use my bare hand, but to arrange it, I will not touch the inner portion, only on the outside.
Ma'am, in covering mo, kailangan maka-sterile gloves ka? Or okay
Or
na ba
clean
yun?
gloves lang. Clean gloves lang. Okay. So I have pre-cut already because I have ascertained the types of wound and the severity of wound before I went to patient's room to bring my treatment. Okay, so granting there is still secretions that will come out, I have to protect it from growing further out. So
So, makagana dito gloves di sa demo.
in the center.
Panabitan ko na yung kuan masturbation.
Okay, so that secretions will not go out there. Also there. Huh? And it will not be too tight, it will not be too loose. Okay. So you can go out because it is of the same size. So if it is not of the same size, you have your bandage scissors, so you can cut on the edges para dili siya pangit tanawon. Okay, so how to take it out? As I've said, when you are going to remove the plaster, the hairs will adhere to the plaster. So when you take it out, it is somewhat painful. Painful, but you can bear it. But we do not want our patient to be uncomfortable. So we have to use some means of being able to remove that without pain at all.
So, i-dry siya sa...
So you have to wet
Yeah, so wet.
Wet?
the front. Moist.
wet the plaster katong
Nakadikit sa pan.
nakadikit sa panit.
Ano sige gamit ang basa ate?
You have agua oxinada. If there is no agua oxinada,
Water.
plain water.
Plain sterile.
No, dili na sterile.
Plain ra.
Plain water, tap water. Okay. So, if the plaster is clean, you can remove with your bare hands or glove hands. Pero lisod ang glove kay magdikit-dikit. And if it is soiled, the plaster is soiled with dry blood, you can remove with your dressing portion. So this one is a clean wound already. So when I remove it, I am going to control. So ang hair dili no, see? Sakit.
Wala na balibo ni Jessa.
Aloy sayang kay pinatubo ka na niya for 10
So,
years.
na-feel ninyo ha? Na-feel. So you are going to control it.
Madala na nag-smile, Jess.
Control. Okay.
Libre wax.
Bira. Langkat pa.
Dili galit na siya hairy, no?
Langgatan.
Kalito na lang din ang shoot.
Okay.
Para isa ran sa
Here. Control it with your hand. Okay. Control. Ang uban lang, katon na lang na. So, mayunta ng pasyente.
Isa na lang.
Ay, ma'am, sakit tayo, ma'am. Okay, gadali ang nurse, no? Always gadali. Okay. Then, if this is not soiled with blood, you can pick it up here. But if it is soiled, you can do it this way. Ayaw siya na, ayaw patanawa. No, just drop it like this. Okay? Then now you clean it, you put it, no new damage. You dress it.
Kasi i-video ko na ko na.
So we will have a return demonstration on that. the next meeting.
Okay, ma'am.
No? So, be ready with your, asa na to inyong book?
Checklist? CER?
Really?
Checklist?
Your checklist.
Checklist.
Oh.
Wala po.
So, we will be able to check it there. Ha?
Kunyales,
Okay, sa YouTube, ito natin ako i-share sa mga link. Text na natin ka.
Ha?